Now, PROfound trial is the first precision medicine trial in prostate cancer that has delivered, right? Let's take this at face value because it's not just about the advent of PARP inhibitors and the approval of PARP inhibitors in prostate cancer. It is about changing the way we treat prostate cancer and not applying a one-fits-all approach. So we saw last year the data that was pretty compelling, suggesting that men who have tumors harboring deleterious mutations of DNA damage response genes have a efficacy or PFS advantage by being treated early on with, when I say early on, after the failure of an androgen signaling inhibitor in metastatic CRPC. The data that we saw last year was pretty compelling because it showed that the primary endpoint was met. There were some back and forth about whether it was more about BRCA2 mutation or the whole spectrum, and this can be debated, but the trial was designed simply and was going to answer the question across the board. Yes, the weight was carried more by BRCA2. But having said that, last year, we did not get data, final data on overall survival, just a glimpse. So this year, this is what for a lot of people becomes important, and we saw it for other agents in prostate cancer. We got the overall survival data. And it becomes, for me, even more significant because we know that a significant number of patients who were on the placebo arm were offered olaparib soon after progression. That is quite important because it also speaks to the fact that the earlier the better. And we've seen it in most cases in malignancies in general. So I think that is the most important take-home message. We need to change our practice. We need to treat men with PARP inhibitors, approved ones. We've got olaparib and now rucaparib. And we have to do it early, of course, within the indication.